Hi, everyone. Are you struggling with severe allergy or histamine related issues? Maybe you've gotten the runaround from doctors and the medications aren't working if you were prescribed anything at all. So many people that we talk to, they're having these same issues and they're only getting worse. Can you relate? What can be done?
Well, a lot. And I have a lot to say about it. And what I'd love to do is not go over all the things that didn't work because that list is going to be really long for people. Today, I'm going to go over all the stuff that works. And in fact, we're going to have three people here today where we're going to show them real people, real outcomes, and go really bust the myths and figure out how did they do that? How did they recover from mast cell, histamine intolerance, or severe allergies? So without further ado, here we go.
Hi, everyone. Thank you for joining us on Transform Table Talk Live with a very highly requested topic, mast cell and histamine intolerance. So important, so popular. I'm Anna Manuel alongside Dr. Maggie Yu. Maggie, this is big.
I'm Maggie UMD, and I am a functional and holistic physician, the creator of the Transform Protocol, which has been really transformative. I mean, it's very out of the box way and a system of approaching mast cell activation, histamine intolerance, and any sort of allergic or food reactions that people have. And here's the thing, if you're watching right now and you know somebody that's suffering with any of this, go ahead and tag their name in the comment section right now because sharing is caring. And if you're an alumni or anyone who's worked with us in any of our programs, type in chat right now that you're an alumni and what you overcame. And here's the thing. I mean, Anne, we're not just about mast cell histamine intolerance, right? But at the same time, I would tell you that, the Transform Protocol is transformative for any chronic disease and any chronic symptoms. However, we did part 1 and part 2 of how to end mast cell activation syndrome and histamine intolerance about 3 months ago. And those videos blew up.
Huge. So many, it just goes to show you how many people this hit a nerve with, and they're struggling with this also. And like you said, this could be a part of any chronic illness because if your body's malfunctioning, oftentimes a step in the process that leads to mast cell or histamine intolerance is a result.
Yep. And I'm going to say anybody who's watching right now, if you have any of these things, mast cell activation, histamine intolerance, you suspect you have it, severe food reactions, chemical sensitivities, asthma, eczema, rash, hives, I can go down that list. Type in chat, tell me a bit more about what's going on with you. Now, in part 1 and part 2 of the videos, these are our most watched on YouTube right now. We went over what's out of the box, what root causes that's causing it, and out of the box ways with which to end it, right? To reverse it. And so if you missed part 1 and part 2, write part 1, part 2 in the chat, and our team will get that to you. We'll share the links with you, get that to you, because those have been the most watched videos. And today we are in part 3.
And the alumni are already chiming in. We love our alumni group. They're so passionate because they're feeling so much better. Like this person can't see your name. So go ahead and grant permission to see your name, but saying, I sleep like a baby now, hormone issues and blood sugar balance. Part of it for that person, at least.
I love this. Carol's watching from Australia. We have a global audience. So it's really amazing that we work with people from Australia, from Canada, Amsterdam, you name it, currently in the program, Peru. So this is really resonating, not just in the US, but because we're an online program that works with people around the world. If you're watching from anywhere outside the US and even in the US, tell me where you're watching from.
Yeah, you have a lot of people that come from Australia, actually.
Yeah.
Made some friends from some of our Australian friends over there. Saying had health issues their whole life.
Yeah, definitely. So I do want to go in with a bit of a teach before we get started, because a lot of people are wondering what the heck is mast cell activation, histamine intolerance, or allergies. And some people don't know what we're talking about. And I'm going to say that when you have an allergic reaction, it can, whether it's to environmental, whether it's to food, it can activate what we call a histamine pathway. And so what I want to do is I actually want to share a screen and show you guys just just so we have a common language with which to understand histamines. So I'm going to say that a lot of people think about allergies and they think about the allergist.
Mm.
And the allergists, most of them are there to really test you for what we call IgE allergies. And that typically is related to environment or food. And most people also think when they have allergic reactions that they think about just allergic reactions. So I kind of want to show you guys right here that when we're talking about food allergens, let's say from food, using food as an example, right there, you can see that there's food particles coming on receptors on these cells in our body called mast cells. And when the mast cell sees these food particles that it thinks it's foreign, doesn't belong there, doesn't like it, it then triggers what we call a release of histamines. Now, histamine pathway is, yes, associated with the top right upper corner where with all of these symptoms, right? Where we think of ear, nose, and throat, mucus, asthma. Sometimes people get gut-related diarrhea, upset stomach, hives, rash, right? A lot of people think instant allergic reactions like that. Well, histamine pathway is also associated with many other systems. So right here, look at cardiovascular. So how many of you guys, and if this is ringing a bell, type it in chat. When you eat a food or you get exposed to a certain allergen, you get what we call cardiovascular symptoms, like your heart starts to racing, or you start noticing that your face flushes bright red, or you start to feel like your heart starts to beat irregularly, or your blood pressure really starts to change. How many of you have POTS? That's postural orthostatic tachycardia syndrome or dysautonomia type symptoms. But you notice when you eat certain foods, that's when the blood pressure switch happens, and that's when you feel like you need to faint. Well, there's a link between histamine and these cardiovascular type diagnoses or diseases that no one know how to treat. Well, I'm just showing exactly what's causing that right now. If that's resonating with you, type that in chat. Someone said face flushing, right? Cardio, like POTS, right? POTS people, please pay attention here right now. Hear me loud, hear me roar. Huge part of POTS, postural orthostatic tachycardia syndrome, and dysautonomia, and a lot of people who have vertigo and dizziness, right? Or a lot of big blood pressure changes or heart racing, seemingly random, is as a result of these allergens that mediates a histamine release that goes to your cardiovascular, meaning blood vessel system. Now, your allergist ain't going to know jack about this.
Yes.
Okay?
It's so unfortunate too.
Don't deal with heart type symptoms or dizziness symptoms or POTS or dysautonomia, right? And your allergists don't deal with heart related type symptoms. So they're going to be sending each other back and forth to each other. And both of them are going to be like, I don't know what to do with that thing. I don't know what to do with that thing. And then looking at this histamine pathway, you also see that histamines can cause, yes, a lot of skin related symptoms or diagnoses with redness, swelling, itching, hives, pain, but it can also be chronic type of rashes, lichen sclerosis, lichen planus. It can be mediated by these elevated histamines. Even people with fungal infections on their skin can be as a result of a lot of these food allergens and histamines in their skin, making the environment on their skin more prone to fungal infections. And then I can keep going. Do you guys like this? Is this helpful?
It's so helpful because no other doctor is connecting all of these dots. It's like you say, you go to an allergist, but they're not telling you any of this stuff. They're certainly not getting into anything cardiovascular beyond what you're talking about. Nope, not at all. So please continue. And you're getting a lot of people are even jumping the gun saying they found some solutions by ordering Digestit and probiotics, which we'll get to. We'll talk about some solutions.
And, this Facebook user, I don't know what diagnosis this person's been dealing with, but basically it's going the merry-go-round between the allergist and the cardio and the heart doctor, maybe even the skin doctor. And then let's go to inflammation pathway. Right here on this section with the inflammation pathway, histamine causes swelling, not just of your blood vessels, but of your muscles and your joints. So how many of you notice that when you have a reaction, it isn't just a standard allergy, you're having these pain flares in association with certain exposures to certain foods? Well, then people are like, who do you go to? You go to the orthopedist who says that you don't have a broken bone, your MRI is fine, you're cuckoo for Cocoa Puffs, let's put you on some antidepressants. Or let's send you to the neurologist or the psychiatrist, right? So there is a histamine-related pathway that triggers inflammation that causes joint, muscle, and even nerve pain, neuropathy. How many of you have neuropathy and nerve pain out there, and you know it's related with your food?
Mhm.
It's because of the histamine pathway. I'm just letting you know right now.
That
So
person's in pain every day.
yeah, it's related with these food particles, mast cells, histamines. And then not to even mention, look at central nervous system here on this corner here. So guess what? Histamines can change their neurotransmitters, which are the hormones in your brain required for focus, required for your mood. So with ADD, ADHD, depression, anxiety, right? Did you know that these histamine pathways can cause mood disorders or inability to focus and even dementia, right?
Dementia. Nobody,
Dementia.
I mean, that's not ever discussed.
Correct. And finally, we have two other pathways. Uterus here is really signifying that we already have data, scientific research papers that actually shows that histamine can alter the amount of estrogen circulating in the uterus, so causing painful periods. So did you know histamine pathway can interfere and interrupt with your hormonal production and breakdown pathways, worsening hormonal imbalance?
This really sounds to me, Dr. Maggie, like it can touch every aspect of your body.
Well, yes, and even kill you with cancer. Look at the cancer pathways right there. So chronic food allergens, chronic histamine release, mast cell overproduction, these trouble with breaking down histamines, these disorders all can increase the risk of certain cancers. So
Okay.
exactly.
So what I guess everybody's thinking to themselves, okay, so why is this so hard to treat?
I think it's really hard to treat because when I show you all those buckets, they don't neatly, well, they involve all the different buckets, right? And so people have a lot of symptoms, complicated history, and they're being sent to doctors in specific branches that know nothing about the other branches and they're not communicating.
Yeah.
So I'm going to ask you guys, how many guys out there have had that experience dealing with symptoms related with allergies and these other symptoms, only to feel like it's a mess and nobody knows what you're talking about? They're sending you to a psychiatrist at this point, and you're getting, so to me, there's not like one person that sees the bigger picture of what's going on above, which is it's all part of the histamine pathway. So, which is why I think I want to bring on our guests right away, because people want to know, how did real people with these real problems, first of all, what do they look like? What is their histories? And how did they solve this problem? So I'd love to bring our guests on right now.
Okay.
And 3 guests with us.
All right, let's say hello to our 3 lovely guests, and we'll have you each introduce yourselves. Jody, why don't we start with you?
Okay, my name is Jody Levine, and I had IgE allergies. I had terrible weed allergies and tree allergies. That was about it as far as IgE allergies. And then I had oral allergy syndrome and burning mouth syndrome, and I was sensitive to everything. I couldn't take medications or supplements. I could sit down next to like a container of shea butter in a room and my mouth would start to swell. I mean, I wouldn't even touch it. I was to the point where I couldn't eat many things and couldn't go out. I was scared every day because I couldn't touch anything. I couldn't eat anything. My mouth would swell, my throat would swell. And nobody seemed to be able to help me. The doctor sent me to the allergist, and the allergist said I needed to be able to take 3 different medications, an H1 blocker, an H2 blocker, and montelukast, and I was sensitive to 2 of them, so that was my only option.
Well, that's the
And
other thing. I mean, Jody's story really highlights how when you go to the allergist, sometimes these people can't tolerate a lot of foods, any of these supplements, and then they can't tolerate medication. So then nothing. I mean, there are no solutions there, even when you go to the doctor to deal with allergy. And Jody had a mounting list of symptoms that wasn't even clearly allergic.
Yeah. And Dr. Maggie, the other thing that I think her story highlights as well, and Laura will be able to speak to this too in a moment, is that she was talking about swelling, and maybe this is starting to become on the verge of life-threatening and anaphylactic reactions. And when you start talking about that, it gets very scary. It has to be taken seriously, and you're not getting any help. So I can relate to probably the anxiety you were feeling, and it's just a scary feeling, and you got to have somebody to help you put a stop to it.
Yes.
On that note, did you want to say something, Dr. Maggie?
I think we should really bring Laura. I mean, this really came to head for you over the past 6 months.
Mm-hmm. Absolutely. Yeah. My name's Laura Mazzata. I've been working with Maggie for a couple of years now. And I have common variable immunodeficiency, Hashimoto's, and autonomic neuropathy. And the autonomic neuropathy, I was told I had after sepsis about 8 years ago, and that I would just continue to become more degenerative over time. But what I've noticed is that it's very cyclical. It's always been very cyclical.
Yeah.
And then what I started noticing about 6 months ago, which I'm so thrilled to have information on now, is that all of the symptoms of autonomic neuropathy were becoming more intense, and then became accompanied with anaphylaxis, really, a closing of my throat, itching all over my body. I was sweating. I was getting fevers. I couldn't function. I was calling 911 very often, running for the EpiPen. And every time I went to the hospital, they would just say that I was having a panic attack. Yeah. And it was just wild to me because, again, it was very cyclical. And I said to Dr. Maggie, I said, listen, I don't think this has ever been autonomic neuropathy, because it's always been associated with food. And I started noticing it when I added in those foods that were higher in histamine. And so then when I started taking some of those away, I was like, wow, this is unbelievable how aligned these foods are with how I'm feeling.
You were not, and Laura, do you mind? I mean, you're underselling yourself. You're a therapist. You previously,
yes,
you're a licensed therapist who knows the difference between a panic attack and a food-mediated histamine shit show.
Oh, 100%. I mean, I've been a therapist for 20 years. I mean, even after sepsis, when I was having the rigors, they told me that I was panicking. And I'm like, okay, okay, that's fine. So yeah, I'm just so grateful. I mean, it was hell to go through. It was very, very, very scary. Some of the scariest times in my life, but I'm so grateful because I feel like I know that this is the root of absolutely everything that has gone on with me immune-wise.
So Laura, that's where she was. And I think, Jody, you've been out of the transplant program about a year and a half or a year ago. And
Yes.
and Laura, we're currently working with you. And then Dana, oldie, she's part of the OG.
Yeah, a little under 2 years ago was when I started with you, Dr. Maggie. And it has been, definitely a whirlwind of a journey, and one that I'm so thankful that I was able to go down. I started when, I was in my mid-20s living in New York and trying to have, this lifestyle, being super sick. For years, I had symptoms related to POTS. So heat intolerance, really fast heart rate. I'd get lightheaded, feeling like I was going to faint all of the time. And I'd get, like Manny said, really flushed, where my face would get so warm that it felt like it was on fire. And I also had really bad neuropathy, so bad that it was basically immobilizing me at times in severe pain. And I got really bad headaches as well. I ended up going to the hospital at least 3 or 4 times, to the ER within 2-year span, because the headaches were just so bad that I thought there has to be something more to this, only to get a mild pain reliever and sent back home the same day. And I was getting
your
super
skin
frustrated
too, right? I'm sorry to cut you off.
No, there's a picture floating around of my before and after. I had terrible skin, and I didn't know, like earlier in my life, I've always had sensitive skin, but I didn't have breakouts by any means. And, starting around 22, I got really infected breakouts, not, normal acne per se, but like just infected skin. And I didn't know why. I didn't know where it was coming from. And I would get hives occasionally too, especially after drinking. I quit alcohol because I couldn't have one drink without breaking out in hives. And the brain fog, severe. And I was really on my last string. And by some miracle, I came across Dr. Maggie via social media and ended up enrolling in her program. And within, honestly, a few months, I was able to really turn around my symptoms. And because the protocol is empowering and teaches you how to maintain that journey in your life, I'm almost 2 years out, and I'm still able to stay pretty healthy and avoid a lot of the episodes I was having prior.
And we can see firsthand your skin still looks fantastic.
Why, thank you.
So that tells us that you're definitely doing well and your skin is reacting in a positive way.
So I want to actually address this for everybody in the audience right now. Do you have any questions right now? Well, first of all, that any of their stories did you identify with? Because I feel like, and I'm going to ask our panelists this, is that when you're going through this, you feel like you're cray cray, or they're making you feel like you're cray cray, or you're the only one, or you're like a really severe case of something, or you're some special rare zebra no one has ever seen. I'm going to ask if all three of you felt that way, because I can tell you right now, these are typical cases of people we talk to every single day. And this is where our community is really important, and stop being a lone wolf about your health. And this is also why we're here, to blow the lid off of all of this. So if you can type in chat, if any of these cases, any of these women resonated with you, type it in chat. And if you have any questions for them, type it in chat. But I wanted to address this with the three of you. Did any of you have anything to add to what I say about that experience?
Yeah, I mean, I honestly felt like I was dying. I thought I was dying because it just kept getting worse and worse and worse, and the reactions kept getting worse. And I thought, when am I not going to be able to catch this in time? You know, like it just kept getting worse. And I was so inflamed and so flushed all the time. And my lymph nodes were so big that I honestly thought that I had lymphatic cancer. I didn't know what was happening, but I just kept getting dismissed by doctors. And I thought, something's going on in the background that nobody can identify. And I keep getting worse. And I just didn't know what was happening.
Felt like she was dying. And this isn't just about a little bit of allergies. And then we got Teresa in chat saying, POTS too, like people struggling with POTS is another thing. She had allergies that people were calling panic attacks, even though she's a licensed therapist and she knows the difference. And Dana, with your POTS and the ER visits and all that, what was that experience like for you?
It was horrible. I went to so many specialists, so many doctors trying to figure out what was wrong with me, because I felt like I was poisoned every day of my life. And what it got me was thousands of dollars in debt, and just being told to go to a therapist and to get on mental health medication. And that's so dismissive and such trauma building, right? And what this program also did for me was I realized I'm not a super special zebra. There's other people out there having this same exact experience as me. And it's, a medical system problem, but we're together and can support each other. And there's a path forward, and you don't have to lose all of that hope.
And it's a real medical problem that our current medical system is not equipped to deal with in any way. No. And Jody, stress plays a huge part in your symptoms. Can you talk a bit about how that was like, that experience of even getting a diagnosis, not having a diagnosis, having multiple symptoms, and all of that prior to me meeting you a year and a half ago?
Well, it's, you don't really have any options, because you just keep getting worse, and the doctors won't address your problems. And I could give them a list of things that I was having happen, just like you're talking about lymph nodes, and it felt like nothing could drain past my throat. It was so uncomfortable. And I would explain that, and they would just go past it. They wouldn't address it. They, no matter what I would mention, I'm having this, I'm having that, it was just ignored. And and you get more anxious and more stressed, because there's nothing anybody can do about it. And you keep becoming sensitive to more and more foods and more and more medications. There's nothing you can do.
I think a lot of you guys have gone to doctors, and how many of you how many alumni are in the audience that can answer to this? And how many of you who are just in the audience has experienced this, where you go to the doctors, and there's really not that much that they can do for you anyway. Or the treatment that they provide is you can't tolerate or doesn't do anything. Right. So it's difficult, because you're going to the right doctors supposedly for those symptoms. But there's nothing that much that they can really do, because there's so many underlying causes they're not even touching, or so many other systems and symptoms that they don't know anything about. Right. So it's kind of a huge mess. And that's why I was going to ask you guys, let's move on to game changers, or where you're at today. I want where you're at today. And I want you to tell me what was the biggest number one game changer, out of the box solution that none of the other doctors even told you about, that caused you to be here. So I'm going to go with Dana first, reverse order. Where are you today?
Today, I am feeling so much better. I have a lot more stability where I don't have to live in fear of eating something that's going to make me feel sick because I know what I can and can't eat. So, the food mapping and testing was super important for me. And then fixing my digestion, making sure that I'm actually breaking down food and that I'm not leaving anything that's readily available for attack by my immune system.
What did you discover in your food mapping?
Well, I had been
Wow.
gluten-free, a lot of discoveries. I had been gluten-free and dairy-free for 2 years. And I was like, oh, I'm being so healthy. I'm getting rid of all of these, things I shouldn't be eating. But every morning I was replacing, normal dairy and cereal with oatmeal and almond milk. And I found out that I am highly reactive to oats and almonds. So realized I was literally poisoning myself every day. So no wonder I felt like it.
Well, that's
And
the thing. I reviewed a food mapping process with somebody yesterday, and I was talking about how critical and life saving is the food mapping process and results for someone, for example, like Dana, because you're told that, oh my gosh, you have these problems. Why don't you just go on it all gluten free, all dairy free diet, vegan, vegetarian, upside down fruitarian diet, whatever it is, right? But the thing is, when you go on any sort of elimination diet, you're going to eat more of something else. Right. And frequently, let's say someone goes gluten free, they're going to go up on almond flour or coconut flour, or they go dairy free and they're going to be upping the nut milks of some type or another. All healthy, all great options, all gluten free or dairy free. But if you didn't know that for Dana's sake, it was what, almond, and was the other thing?
Yeah, almond and oats.
Oh, oats are healthy. She's doing gluten-free oats. That's an alternative. Why not, right? So, I mean, this is life-saving information that your doctors are not able to provide, and your naturopaths and functional doctors can't provide. I mean, I don't know how many of you guys saw naturopaths or functional doctors and either did elimination diets with them or food allergy or food sensitivity testing, and that didn't yield the answer for you that you did in our food mapping process. Jody, can you speak to that?
Yes, I did 2 different food sensitivity tests, and neither one looked like the other. And they had tons of foods that I couldn't eat. And I was already extremely limited on what I could eat. And I was like, how am I supposed to cut out any more foods? I think I can only eat 15 things. And
15, it was like 7 when I met you.
yes, and it was like the 2 tests were completely different. So then you did one, and I had 3 things. 3 things.
Just 3.
And what I have, one was dairy, one was chestnuts, which I very rarely ever ate before anyway. And then what was, I think the other was just the wheat. Oh, and eggs.
Yeah.
And
Eggs are healthy.
I found the other day, I tried to reintroduce hard cheese just a little bit because the soft cheeses were a hell no, you had said. So the hard cheeses,
That's how
I was
specific
sort
I
of
am.
borderline. Yes, so I thought I'd try that. And then for 3 days after I had it, my oral allergy symptoms revved up.
Boom.
So the fact that I haven't had those in a year and a half has really been helpful to keeping things down. So I think your food sensitivity test has really helped me.
And you know what, though? A lot of people think food mapping is a food sensitivity test, and it's not. It's a process, which there is testing involved, right? Accurate testing, right? Instead of 50 things from 2 tests that Jody eliminated and could only eat like 7 to 15 foods, we did accurate testing that said, nope, 3. And on top of it, even in the dairy category, I was extremely precise because we actually teach people in our program this whole process and how to understand these test results because there's so much subtlety and data, and there's false positives and there's false negatives that people need to understand so that she's accurately understanding the data, not only from the test, but now from her body.
Mm-hmm. And so what's the result? You mentioned that you were dealing with so many issues and you couldn't even be around outside because you were allergic to weeds so badly. So I'd like to hear what's going on with that.
Oh, now I can be out there working for hours and I'm fine. I'm fine. I was out there for 2 or 3 hours today earlier and I'm just fine. this afternoon. I'm not exhausted. I'm not laying down, like holding my head and feeling like I can't get up. And I mean, it was an everyday thing before.
Yeah. And you have a farm, right?
Yes, yes. So I couldn't help my husband. I mean, he was out there trying to do everything himself, and now I can help again. I can get out there and work, and it makes me feel better to get the physical activity in too. So
And so for you, it was both removing those foods and it sounds like it was focusing on stress.
yes, removing the foods. I think that adding DAO was a big deal to my meals to
DAO
help.
type supplementation. So we're talking histaway.
Yes,
So there's
yes.
supplementation that can lower histamines as well. So being able to remove those 3 foods, adding the proper supplementation to lower histamine, step 2, and then step 3.
I think also LDN has been helpful because on days when I have accidentally forgotten to take it, the next day my mouth feels a little puffier and I'm thinking, boy, why is this different? And then I'm like, oh yeah, I forgot to take that last night.
Well, that's the
So
other.
I think that has helped along with stress management, like meditation. Those things have all been huge.
Yep. I love that. But the other piece is how much of the foods have you been, because you were eating like less than 10 foods when I met you, Jody. So how many food, what's your diet like now?
Oh, I'm eating all kinds of things. All kinds of things. I still don't eat out because there's so many other things in the food that I have not had a chance to reintroduce yet to see how I react. But I can eat all kinds of things. I can even eat chocolate now, which I couldn't eat for years.
Welcome back, introducing hundreds of foods that you enjoy.
Yes.
And then I'm curious,
Yes.
because I know you mentioned, you were anxious about all of this and it was hard day to day. Now, are you able to feel a lot more comfortable? Do you even maybe eat out?
I don't eat out very often, but I just had a birthday yesterday. I had a chocolate cake. It was gluten-free, dairy-free, egg-free, but it was fantastic and everybody loved it. And we were able to have a cookout. I was able to eat hamburgers and hot dogs and
Oh my gosh, Jody.
coleslaw. I mean, I couldn't eat any of these things before. When I sit down to breakfast, I look at my breakfast now. I couldn't eat anything on my plate before.
Night and day. Congratulations. What a 180 for your life.
So I noticed Jody mentioned supplementation. And so Laura, we're going to go to you because what do you think, where are you at right now? And what do you think were the biggest game changers for you?
Right. So right now I'm expanding the foods I'm eating, which is great because I could only eat about 5 foods for a while there. And it was getting more and more limited. And ketotifen was a game changer for me.
Which is a compounded medication you and I really talked about. So is LDN that Jody was talking about, low dose naltrexone. These are out of the box solutions that your doctors don't know about. Okay.
And the DAO was great. That kind of helped me temporarily, but ketotifen really calmed my system down. And the longer that I was on it, the less DAO I needed to take. So I really don't have to take much histaway anymore, which is wonderful. Every once in a while I'll get a flare, but I've been expanding my foods, which is wonderful. And it's given me more of a range of eating that I've had in months and months and months. And really that's because of all these, I had cut out food, the things I was intolerant to with foods a couple of years ago when I started working with you. And that was the biggest initial game changer, but my digestion has been this way for over 40 years. So it definitely impacted my immune system and my symptoms. And I'm kind of like relearning the map of my body in terms of what's great is that with the ketotifen and removing all of those intolerant foods, I feel like I have a clean slate now. Mm-hmm. And so now that I have a clean slate, I don't need as much testing because when I start to ingest a food, that I know immediately that it doesn't agree with me. I know immediately what it is because everything else, all the other noise has been removed from that map. And so it's so helpful to be able to troubleshoot this myself. It's honestly very empowering because I can eat something and then say, okay, this, boom. Okay. I know I'm not eating that again, and it could be something that I try later on, but I've been able to really calm my system down to a space that I can make those decisions with clarity very quickly.
You mentioned that you were running for the EpiPen and the throat was closing up. And so that is a long thing of the past.
Oh, definitely. I haven't had reactions like that in months. Yeah.
Because that is the stuff of nightmares. I mean, that's the stuff that really, if anybody's struggling with these issues, keeps you up at night. You worry, when is it going to happen? In what circumstances? Where will I be when that happens? It's almost paralyzing to live like that. So to hear that you were able to put that behind you must feel like a relief beyond relief.
Oh, absolutely. Absolutely. I feel like myself again.
So there was a lot of discussion around supplementation, and I want to know if anybody in the audience had a question about supplementation. And I wanted to just share really briefly that I'm going to share my screen. People are like, what are they talking about? Histaway. Here we go. So what histaway is a DAO enzyme that can actually help break down. What histaway is a DAO enzyme, and what that can do is it can help to actually, once histamines are even released, it can help break it down faster. So it's really great for food-related allergens. So if you know you got exposed and suddenly your mouth is already itching, you're already starting to have a reaction, taking histaway and a bunch of it to really break down, produce histamine already is a game changer. So that's called histaway. The other product that people are talking about is going to be around digestion. And this is our allergy essentials, by the way. And I'm going to ask right now, and I'm going to ask our guests to actually think about right now, because several of you already mentioned digestion. But one of the mast cell activation, histamine tolerance, part 1, part 2, I really went into digestion. And so and without going to details about part 1, part 2, one of the biggest game changers for people with mast cell is digestion. And because it's a multiphasic digestive enzyme that helps every step in digestion. And I'm just going to tell you right now that, to put it simply, part of what helps when you think about all the food that's presenting as allergens is that the bigger the food particles are, the more allergenic, allergy irritating they are. So when you actually digest the food properly, it means you're breaking it down to smaller and smaller particles. When you break them down to smaller and smaller particles, they are lower and lower to no longer allergenic. And yet, most of the people with mast cell, histamine tolerance, allergies, eczema have a digestion problem in the first place, and that's why they have tons of allergic symptoms. So that's just put in a nutshell why taking something like a multiphasic digestive enzyme that has minimal number of ingredients that covers every step of digestion is really critical for people with mast cell or histamine intolerance. So I'm going to ask our guests. Several of you mentioned digestion. Who can really speak to how big was actually understanding and dealing with digestive problems a game changer for you?
Dana.
I know, you see me nodding. It was everything for me. I mean, I could say that prior to coming into the program, I knew I had digestive issues. I had like chronic SIBO, gut infection for quite many years, and went on multiple rounds of antibiotics trying to treat gut infections. And I had, this is lovely to say, but chronic diarrhea and constipation, like a mix of the two. My digestion was terrible. I weighed less than 94 pounds. Like I couldn't gain weight for the life of me because like I just wasn't breaking down food to actually absorb the nutrients. And so I was in a real predicament. And then once I started to digest it, it took about 2 weeks, but I started to notice that I was having weight gain and that I, was having my symptoms of abdominal pain removed. And, ultimately that helped with my histamine-related symptoms as well. And I still take Digestit to this day. I know that that's the supplement that's my real win. And I notice when I don't take it that I do have less of a flow, if you will. So
I think all bowel movements.
Yeah.
And all three, I think, of our panelists lost a ton of weight in the middle of these giant flares to the point of almost scary, life-threatening level of weight. And that's from poor digestion, high histamine, poor absorption of nutrients, poor tolerability, and then poor absorption of nutrients. I mean, Jody, who else? Laura or Jody?
I'm included as well.
Okay, well, Laura, can you share a little bit about your experience with your digestion wins?
Yeah, so I mean, I had common variable immunodeficiency and was on plasma infusions for years. And I've since been able to come off of them, which is lovely and wonderful because I've been taking biofilm buster and vitamin A and all the things. But you know, our immune system lives in our gut, and I had chronic issues with diarrhea and just a lot of stomach pain and discomfort for years, and really certain foods that, of course, I didn't realize were my body rejecting them. But what I also realized, I ended up losing my gallbladder in the middle of, or not long after I joined the program, actually. I think I lost my gallbladder, and it's just because all of that had built up over the years. I mean, it had been going on chronically for years. And to be able to have the combination of digested and ox bile was a game changer. At first, I just took digested for a while, but then I realized that taking one digested and one ox bile was really my sweet spot. And I could just, I mean, I never had any digestive symptoms after that. I mean, it was just easy.
I mean, you hear that time and time again. And once people start getting a handle on their digestion and they're taking these supplements like you're mentioning, we had that comment up just a moment ago, that first pill of Digestit, and it was like, you know, the world changed.
Well,
yeah, absolutely. And like I had chronic nausea for years, chronic nausea. I mean, every single time I ate, I would be so sick. And I said to myself, well, they told me that that was the autonomic neuropathy because it's my autonomic nervous system that is responding and getting activated every time I eat. So every time I ate, I would feel extremely nauseous. I would have to eat meat or mince and take supplements and all of these things. And really what I realized was it was a digestive issue. So when I had the Digestit, it was like, that was just gone.
Dr. Maggie, why is it that when you go to the allergist, no, they're not talking to you about digestion at all?
There's no training in digestion, right? So, I mean, logically, just think about this, everybody, okay? We just mentioned digestion having to be a major trigger of increased histamine reactions, right? And then histamine reactions triggers all sorts of other symptoms. You go to the allergist, and the allergist is trained to do blood or skin tests to identify IgE anaphylactic allergies only.
That's it.
They have no training in GI gut. And I'm going to tell you right now, you go to the GI doc and they have no training in digestion.
That's criminal. Because that's, I mean, you're really going to there for help with that system. And yet they can't offer much in the way of that other than probably testing, you know, we'll do a scope.
We'll do a scope. Oh yeah. It looks fine. But the thing is, digestive breakdown, your cell lining might look fine, right? But it's a functional problem. If you can't break down the food and they're presenting in bigger allergy pieces, they're more allergenic, that's the problem. You may go to a GI and say, is it my digestion? Is it irritable bowel syndrome? They scope you, might look normal. And then they're like, I don't know what to do with you. So people are going ping-ponging from specialist to specialist, playing whack-a-mole. And nothing we're talking about here, like we've already talked about some top things, everybody. I mean, we talked about supplementation with histaway. We talked about supplementation with digestive enzymes. We talked about the role of digestion in dealing with mast cell, histamine, and allergies. We haven't even delved into like blood sugar, hormone imbalances, infection in your gut. There were hints around here with that. But which one doctor you go to actually can deal with all of that? Is there a system in place with which all of those pieces can be addressed, right, adequately to produce quick and permanent results for people? And the truth of the matter is that system doesn't exist outside of what we're doing here. You've never heard this outside of what you've heard here today.
And so many people try to do their own research and try to put the pieces together on their own because they get frustrated, just like you're saying, with trying to go to this doctor and this doctor and this doctor and maybe not getting any help at any of them at all. And so they go into their own research, but it's impossible to find the information that you're saying because really you're the only one that is putting all of these pieces together.
Question for you guys. I mean, I brought up a couple. I kind of cheated telling people was in part 1 and part 2, but I'm going to ask you guys for any of you, was infection, in fact, one of the things that triggered elevated histamine in you? I didn't even mention this. This is not just food particles, everybody. Hint, hint, from part 1 and part 2. I talked about how having an increased load of infection, whether it's from SIBO, bacterial imbalances in your gut, C. diff, whether it's fungal like candida, whether it's parasites, right? Even the big C. All of those types of infections will trigger a huge histamine release from your gut cells, the mast cells that are around your gut digestive tract. So that will cause tons of symptoms. So, I mean, and does your mast cell specialist or histamine allergist or your GI doc know jack about infection? Chronic gut level infections that are triggering this? They even tie it together. For which of you would you can speak to that?
I see Laura nodding.
Okay, Laura, how big was infection?
Yeah. No. Oh yeah, gut infect. But again, I'm so grateful for it because it's really giving me a window into what's been underlying everything. And so it's always been there, but the gut infections, multiple gut infections at once, flared it so much that it was so in my face and so dire that I didn't have a choice but to say, like, okay, I gotta look at this differently. Like, what I'm doing is not working. I have to look at this differently. And yeah, so the infection, but the beautiful part is the ability to regulate it in your program with your guidance prior to even the gut infection being released, you know, and that's what's so comforting is like, well, I don't have to sit here and suffer for months and months and months and months until the gut infection is cleared, or, you know, like, I don't have to sit here and wait for that. Like, you're able to make me feel better right away, which is, I'm so grateful for, because by the time we get to a place like this, we've already suffered long enough.
I'm going to share the screen really briefly because it's what Laura's saying is like, there are all these pieces of the pillars of transform, you know, and if you guys haven't seen the 5 pillars of transform training, write 5 pillars in chat. And just something to think about is notice here on this first pillar is blood sugar mastery. We haven't even dove into how blood sugar triggers these allergic reactions. Nutrient density is from majorly digestive issues. So digestion and then the subsequent nutrient deficiencies. We've talked about food mapping and how knowing your true food sensitivities, false positive, false negative, real data, real outcomes, not just elimination diets. And then in the hormone balancing piece, we haven't gone into it, but the role of your good bacteria in your gut to ferment really breaks down histamines and toxins. And then this whole concept around gut health, people talk about infections. And number one here under that, the order is just plain wrong in how we deal with gut health. How do you actually deal with infections in your gut, which is then triggering histamine reactions without mastering your blood sugar, without dealing with your digestion, without doing food mapping, and without helping fermentation and liver detox of your body? You just can't. There you go. Boom. I'm just referring. And the thing is that Laura brought up the point is, what are the 5 pillars of transform? But also, what is the pillars in the right order? And instead, people are going to doctors and even naturopaths, functional clinics. Let's deal with infection. You will never be successful clearing infection without the right order of dealing with all these other pieces that had set your environment of your gut up in the first place for that infection and for it to come back over and over again. So order really matters.
And speaking of order, one of the other first things that you have us do in the program is we start uploading on that water. You have us with the water challenge, and you could probably speak to that as well, in that diluting these allergens.
Dilution is digestion. Dilution is detoxification, right? And yet so many people are sitting here on elimination diet. They're nauseated all the time. They're sick all the time, and they're dehydrated as heck, which is why one of the really important pieces, one of the first modules we have is how to actually calculate and measure and consume every day the optimal amount of water for you personally. So hydration, huge part of this. And hydration is digestion. Yeah.
For our guests tonight, I'm just so curious to hear, what would you want to tell other people about your journey, to people that might be dealing with some of the same things that you have gone through? Jody, can we start with you? What would you want the message to be to others out there who might be struggling with similar symptoms?
That you can find a way to make yourself better. And Dr. Maggie's program was the first step I had to take in order to get there. She sort of peeled away all of the symptoms that
Yeah.
were just making noise. I mean, you know, like the neuropathy and the eye styes and cold sores, and I mean, all this stuff that once I got through the program, all of this stuff started going away. And then I could actually see that, you know, what's left is, you know, this oral allergy and the burning mouth. And so it's, and at that point, Dr. Maggie said, I think you have mast cell and histamine issues. And that was the first time anybody had told me, you know, you need to concentrate on this, as opposed to, you know, even when I went to a nurse practitioner before, she would just say, research this and see what you think. But everything she told me to research, I had all these symptoms of everything. I mean, I thought there's no way I can have all this stuff. So I didn't know what I had. I needed to have somebody help me peel back all of the noise and then say, you need to concentrate on this. And that's what she did.
This step, this step, this step, this step, this step. That's how you eliminate fear.
In that order.
Correct.
Dana, how about you?
I think I would just reiterate that you're not crazy. Your feelings are valid. Your symptoms are real. And although your doctors may not be validating you, there is a whole community here that will. And we truly are a community. I think one of the things, besides Dr. Maggie's expertise, that I valued the most in this program was just the support and the love from other members. I was really struggling, I think, just mentally and emotionally before the program because I felt so alone and isolated for people not believing me and my symptoms. And I was able to gain other individuals in my life who did see me and made sure that I received the support I needed.
Yeah, that is a big part of it, is this community aspect. And you're right. There's your closest friends and and your family, even if they have the best of intentions, they don't get it quite often. They don't understand what you're going through. And sometimes they might frankly not even believe everything that you're going through. So to have a community of people who not only believe you, but understand you because they've been through it also, and then to see them getting better and learning from them as well, it's pretty special.
I think for Dana's point, if those of you that are watching right now on YouTube, a couple things. If you're watching on YouTube, make sure you subscribe, give us a like, and ring the bell so you get notified every time we go live. And Dana mentioned community. We have an incredible community on Facebook, and we'll share the link in chat. Join our Facebook community, which is Transform Your Health Naturally. Click the link and join the group. That's another great way to realize you're not alone. And we do tons of trainings and lives just like this to actually help educate you and your loved ones to blow the lid off of difficult, complex to solve medical issues like mast cell and histamine intolerance.
Definitely. How many people are in the group now? It grows every time I check
We're
back.
over 80,000. I think we're at 82,000 right now. I believe it is the largest Facebook group dealing with chronic health issues.
Yeah. So such a great support system. All right, Laura, can we hear from you?
Yes, absolutely. So I was actually going to say something similar to what Dr. Maggie was just saying, which is that what I would mention to people is to really become open to education about your unique physiology, because that was one area that I felt was really missing, that completed the holistic picture for me, because I knew all the things from Western medicine and I knew the basics just from being an educated woman, right? But getting down to the customized understanding of my unique physiology and how my unique systems work, the ability that Maggie has to customize every single step to exactly your physiology. Because I always say all of us are snowflakes. We're all completely different, right? We have the same parts, but we're different. And so it's being able to be super educated in that. Again, like I said before, it's so empowering because I'll sit down with Maggie and we'll start to talk about a solution and I'll say, hey, I was thinking about this. And she's like, see, that's why I love this program, is because we get so beautifully educated and we feel like we are experts on our own bodies and we can troubleshoot and bring it to her and just get that validation. But it's so wonderful to be able to walk away and know, if this comes up, I do this. If this comes up, I do that. If that comes up from the doctor, I'm going to look at it this way. And she even gives you scripts of how to speak to the doctors that will assist you with advocating for yourself so that you can continue to feel really independent in managing your health going forward.
Wow, I don't think I could have said that better. You shut this trap up, Laura.
Wow, that's awesome.
Well, and I actually, and I'm going to say, I speak for all four of you guys, is so all of the people that I work with, I feel like by the time you go through and you get more and more educated, I really feel like after a couple months, it's like we're on a conversation level that's collegial. Like I feel like we're working together on your health, and you're at such a high level of education. We're troubleshooting together, and other people in the group are jumping in, and it's just such next level, right? Nicole Lynch is from Australia. You know what we're talking about, Nicole, right? I feel like so many times we're having collegial conversations, right?
Well, that's thanks to you and the education that you've provided, though. You were able to provide it in such a way that everybody can understand it, everybody can digest it, no pun intended. And really, we're able to then, as Laura so eloquently mentioned, be the pilot for our own health.
It's fun. It is fun for me to be able to, I mean, listen, I felt alone for probably most of my career. And most of the time I was sick until pretty much the last 15, 16 years when I started embarking on finding and figuring out these solutions, and then sharing and then teaching it, and really growing and gathering a community of super smarty pants around me like this. I mean, I'm thrilled to pieces, and this has been so much fun and so gratifying.
Yeah. Anybody want to leave any final thoughts? Just quickly, a final thought, one sentence from each of you. Dana, what would you say as we're closing out here?
Say that Dr. Maggie changes lives.
So great. What about you, Dana? What about you, Jody?
I don't know what I would have done if I hadn't taken her program. I don't know where I would be right now, but I don't think it would be good. I'm so thankful that she had her program available to us. I've been dealing with this for 30, 40 years.
Wow.
So yeah, I'm very thankful.
And Laura, you continue to work closely with Dr. Maggie. What would you like to add?
I mean, I'm never leaving, so good luck with that one, Maggie. But the other thing, I'm never leaving again, ever. And the other thing is just like, if you're afraid to join a program like this, I was very afraid to feel worse because I already felt so bad and I didn't want to feel worse. I can promise you that Maggie has a creative solution that's gentle and loving and compassionate to your specific body and issue, that you don't have to worry about that. She's going to take care of you.
Thank you. Thank you, everybody. And I really appreciate this live panel has been here. I'd love people in the audience to give them a boom in the chat, in the comment section, to thank them for showing up on social media. I mean, it's not everybody's a social media extrovert butterfly. So thank you so much to all of you guys for your generosity and your share and your vulnerability. And for anybody out there who wants to learn more about working with us, start a chat with our team. We're going to throw a link in the chat. You can start a chat with our team. And if you want to, the other way that you can do is actually book a call with our team. If you are serious and you want to learn more about the Transform program, looking at the 5 pillars, you're like, I want that. For me, we're going to put a link to schedule a call with our team as well, if you want to schedule a phone call instead of a chat with us. All right, everybody. I think that is a wrap. With that, we're going to say bye, everybody. Have a wonderful day. Thank you.